Torres here in the NBC News on this Facebook Live, and I'm going to talk to you about some headlines you've probably heard over the last week or so, give you some information behind those headlines, and then answer questions you might have. So if you have questions, please send them our way so I can get to as many of those as possible because they're always fantastic. Let me start with the headlines first. One I want to talk about is you've probably heard about the variant that's here in the United States. It's called the UK variant. Well, here's what's happening. Currently, the UK variant, which they first noticed in the United Kingdom, thus the UK, back in September timeframe, maybe August, September timeframe, and they noticed it was starting to happen in certain areas of the country, South England and London, where the strain was popping up, and then it became the dominant strain. The reason it became the dominant strain is because when they looked at it, they found out that the strain had mutations on the stem of the coronavirus cell itself. What that means is the stem, which is the part that attaches to the receptors on your cells and then lets the virus get into the cell to do its business, that stem was able to attach much more readily than the other types of, the other variants of coronavirus. And so they said, okay, is this going to become predominant? Because now it looks like it's more contagious, it's more infectious. In other words, people can get it more and they can spread it more easily than the other coronavirus variants that are out there. And sure enough, that's what happened. It is now the dominant strain in England, and it's hitting other parts of the world as well. As a matter of fact, by last notice I saw, it was well over 30 countries have identified this variant in their countries. And here in the U.S., it was identified first here in Colorado, then in California, and then in a variety of other places. Now, subsequently, we heard about a South African South African variant that came out that looked like it was infective too, more infective than the normal variant, and possibly even more infective than the UK variant because it had more changes to that spike protein we're talking about. And then other variants started coming up. There's variant Columbus, Ohio. Researchers found a variant there, but they don't really know how pervasive it is. They just know they found it in that area, and that showed different changes as well. And to give you an example, the UK variant is a B117. Other variants are B1.123, and so they vary from virus to virus and variant to variant. But the big question, this is what I want to answer, and I'm getting this from viewers, is we hear the word strain, we hear the word variant, we hear the word mutation. Are those all interchangeable? And the answer is no, not really, not from a technical perspective, because here's why. So the strain means the virus itself. In this case, it's SARS-CoV-2, which is the coronavirus that's affecting us right now in the pandemic. That SARS-CoV-2 has been the same strain since the beginning of the pandemic. And as I tell people, think of this like the flu virus. There's H1N1, there's a H3N2, there's a type A, type B. Those are the strains of the flu virus. That H1N1 strain could have variants. It could have, and usually they have much more letters behind them. They're called clades or subclads. They have H1N1, and they'll have a B1C3, something, the letters keep going on and on. It's those letters after that H1N1 that change that cause the variant. Same thing here. SARS-CoV-2 will have letters afterwards that B117 or B1123. Those are causing different variants. So that's the strain. The strain has stayed the same throughout the coronavirus, and that's important because if the strain stays the same, then more than likely the vaccines will be effective against it. The treatments will be effective against it, assuming the variant doesn't change too much. And the reason the variant changes is because of mutations. And the mutations happen on a genetic level, and these are constantly happening all the time. Every time a virus invades a body, they end up having these mutations. Mutations are basically mistakes in copying that RNA to develop a protein or to develop the virus. And what happens is when it copies that strand, that genetic strand, it might not copy it exactly right. There might be a letter or two off. That's a mutation, and that can cause some changes. The vast majority of those are what we call deleterious. They basically affect the virus in a bad way. So the virus can't get in the cell as well. It can't replicate as well. It can't do its business as well. So they're bad mutations as far as the virus is concerned. But these mutations happen constantly, billions of mutations since the beginning of the pandemic. And those mutations, occasionally, out of those billions and billions of mutations, there will be some mutations that will be advantageous for the virus. And that's what we're seeing here. If those mutations crop up and they're advantageous, and there are enough of them to make it more advantageous than the prior variants of coronavirus, then they call it a new variant. So The strain develops mutations, which then can develop a variant if there's enough mutations and it changes the virus enough to make it more likely to infect, more likely to cause issues. The one good thing about this is we know now that it looks like it's more infectious. People can catch it more, they can spread it more, but it doesn't look like it causes any more complications, and it doesn't look like it's any deadlier than the other variants of coronavirus. So remember, the strain's been the same, it's these variants that change. And so since that is happening, again, they think the vaccines are going to work, they think the treatments are going to work. But remember, just because that one virus in that one person doesn't cause more complications or the risk of dying, it's a numbers issue. So the more cases that are out there, the more people are going to get it, the more people are going to suffer complications, and unfortunately more people are going to die because of this. And so this is one of the things to think about when it comes to strain, variant, mutations. So again, the strain is SARS-CoV-2. Mutations occur all the time on a genetic level, and if enough of those mutations cause advantages for the virus, then it's a variant of that virus. And so that is the strains themselves, the variants and the mutations. Now, the other thing in monoclonal antibodies, now we came out with this treatment, monoclonal antibodies, back in the probably late springtime, summertime, they started looking at them. What monoclonal antibodies are basically they take antibodies from people who recovered from coronavirus, they take them to a lab and they start duplicating them. And they make sure that they're ones that can specifically attack this strain of coronavirus. And they duplicate those. In some cases, they put two together and they give it to people, this dual monoclonal antibodies. And what they found is these monoclonal antibodies, if they're given early enough, and that's the important part, if they're given early enough in somebody's infection with coronavirus, they can actually reduce hospitalizations, which is fantastic because our hospital systems, number one, are being overrun, but number two, for you personally, if it's early enough, it can reduce hospitalizations. The problem is they're not being used all that much across the country. There are monoclonal antibodies out there. As a matter of fact, the CDC has a monoclonal antibody tracker you can go to, put in your zip code, and in some instances, it'll tell you where in your area you can get these monoclonal antibodies. It's a treatment that needs an IV infusion, takes around an hour, and it has to be done early on in the course of the infection. So what's the current recommendation? Well, the current recommendation is if you're 65 or older, that automatically puts you in a high-risk category, or if you have certain underlying medical conditions that put you in a high-risk category. We're talking diabetes, heart disease, obesity, cancer, those types of conditions. Then if you do test positive for COVID-19, talk to your doctor about getting monoclonal antibody treatments, whether you have symptoms or not. Talk to your doctor about getting those treatments because the earlier you get them, the better. Now, of course, one of the issues is, especially now, because the numbers are so high across the country, is that they are basically, sometimes it takes 3 or 4 days to get your to get your coronavirus test back, your COVID test. The issue is by 3 or 4 days, the virus has already taken a foothold in your body and it's harder for these monoclonal antibodies to work. And so they're saying, yes, even if you had a rapid test, an antigen test, and it's positive, you should still talk to your doctor about getting this monoclonal antibody treatment. But know those treatments are out there. Know that they're not being used that well. But as a patient, go ask your doctor too. If you test positive, and again, you fall into those categories, 65 or above, or underlying medical conditions that put you at higher risk of complications, talk to your doctor about getting these treatments because it could help keep you out of the hospital, it could help you survive coronavirus better, and it could help shorten the time period that you're actually suffering from any symptoms that you might have if they do start cropping up. And the reason I'm saying, even if you don't have symptoms at this point, talk to them, because often people will be what we call pre-symptomatic. In other words, they'll test for it because of their job or a trip they took or whatever reason. They test positive, but they feel fine. They have absolutely no symptoms. And 3 days later, they start developing symptoms. By then, again, the virus has taken a foothold in your body, and it's going to be harder to fight off. The earlier you can treat it, the less viral load is in your body, the less virus is in your body, it's easier to treat, especially with these treatments like monoclonal antibodies. Now, the last thing I want to talk about is President-elect Biden has come out, or he is coming out today with his pandemic plan as far as vaccinations. Now, as we know, the vaccinations have been a bit of an issue here. If you look globally, the U.S. is doing fantastic. We are definitely high up as far as how many vaccines we're getting out, how many people per 100,000 we're vaccinating. And part of that is because we help manufacture some of these vaccines, like Moderna was manufactured with the National Institute of Health's help. And so we do have essentially dibs on it at this point. It's going to certainly turn globally here soon. and it's going to other countries as well, but they're giving a lot to the United States because of prior agreements we have. But if you look at the current numbers, and this is off the CDC vaccine tracker, and they have various trackers, right now they're saying a little over 30 million doses have been distributed. Out of those 30 million doses, only 11,000 have been administered. And what's happened up until now is a couple of things. One, the current administration has held back second dosing because they're saying we want to make sure that people who get the first dose can get their second dose at either day 21 for Pfizer or 28 for Moderna. We just want to make sure we have that available. But even considering that, so far less than half the people have actually gotten the dosing that is out there, which means it's in freezers and refrigerators. And as I often say, a vaccine in a freezer or refrigerator does nobody any good. It has to be in somebody's arm in order to help fight the coronavirus vaccine or virus from getting into them and help fight the pandemic. And so we still have a ways to go even to get that. The logistics are an issue right now. And if you talk to experts, they say, yeah, one of the issues is that we got this emergency use authorization over the holidays. People were on vacation. It was harder to get things started. And now there's a big rush to try and get them. What you're going to notice across the country over the next couple of weeks are more mass vaccination centers, more mass vaccination events, more word out there. And part of that has to do with what is happening now. The CDC has recommended 65 and above. It should be open for them. Other experts are saying it's a little too fast for that, but states are going to make their own decisions. Here in Colorado right now, they haven't gone down to that level yet. Right now, it's first responders, 70 and above, healthcare workers, long-term care facilities, but eventually, the sooner they're going to open up to 60 and above, they might incrementally step to 65 and above. But again, one of the issues is the logistics of getting the vaccine in there, and that's what President Biden is addressing. A lot of money is going to go into helping the states with what they need to get it in there, possibly using the military, the National Guard to help distribute and administer the vaccine, because the National Guard has a large number of medical personnel that can be used to help doing this. And you might notice centers set up, mass vaccination events set up to try and get people vaccinated as quickly as possible. And I really think over the next few weeks, over the next month or so, you're going to see this really rev up and people get more and more vaccinations. People have the ability to get more. Right now, it's a bit confusing. Best advice, go to your state public health department website. They'll have information on there. That information should break down how you can get it, where you can get it, and what you need to do to register to get it, because the majority of these are appointments that you need to get. Now, it's still complicated, it's still hard to get, but it's getting easier and easier as time goes on. And hopefully, when President Biden announces that today, he's going to announce, number one, that putting more money into getting the vaccine out there and distributed and administered, the important part. Number two, he's not going to save those second doses. He's going to basically push them all out on the market. So instead of having 30 million doses, we'd have 60 million doses. And granted, at this point, some of those would still be in the refrigerator or freezer, but at least we have them available to start these mass vaccination events, to start the ball rolling. He wants to have, in his first 100 days of office, remember, he takes office January 20th, first 100 days would push him to the end of April. He wants in those 100 days to vaccinate 100 million people. Doing the math, that's 1 million people a day. We're not even close to that at this point, but hopefully we get to that very, very quickly. And then once we do, we get this ball rolling and more people get vaccinated, because that's an important thing. Now, again, looking at the headlines, variants, talked about the difference between a strain, a mutation, and a variant, because the wording gets confused. A strain is basically the virus itself, SARS-CoV-2, which stays the same throughout the pandemic to this point. Mutations change in that strain, and if the mutations change enough, then they call it a variant. And so it's a variant of the strain due to mutations, if you want to say it in one big sentence. So that's the variants itself that you've heard about out there. Monoclonal antibodies, the treatments are available. You just have to know to ask for them, because for some reason they're not being used quite as much. So again, if you're 65 or above, or have underlying medical conditions, and you test positive for COVID-19, whether you have symptoms or not, ask your doctor about monoclonal antibody therapy and whether it's right for you. And then President-elect Biden, he's going to be coming out with his vaccination plan, which should show more robust delivery and administration of the vaccine. And hopefully we get more people vaccinated and get through this sooner rather than later. Let me see if you have any questions now.
Is there a funding issue at the state level that we can be working on to get the vaccination out faster?
So at the state level, the question is there a funding issue at the state level that we could be working on to get the vaccine out faster? Yes. So at the state level, the issue is a couple things. One, funding, and two, the personnel to do this, which they kind of are hand in hand. Public health departments over the last couple of decades have been reduced in their manpower, reduced in their budgets, and reduced in their ability to get out there and actually do the public health work that they need to do. Part of that stems from the fact that we really haven't had huge public health issues. Ebola came out a few years ago, 2009 time frame. and we've had the H1N1 pandemic that came out. These are issues that every time they come out, more and more experts are saying, hey, we need to refund our public health departments. And then to a sense, it falls on deaf ears, or we have very short-term memory, and we forget about that and don't quite fund them where we need to do. Well, now we get to a pandemic, and once we get to a pandemic, we realize that it's severely underfunded. It's severely undermanned personnel-wise, and they don't have the ability to do the things they need to do. Well, President-elect Biden wants to come in and really gin that up, really get public health departments to do what they're supposed to do, get the CDC to take the forefront on this and really start driving home both the messages to get pandemic under control using what we call the social measures, face mask, social distancing, washing your hands, avoiding groups, doing those things while we get the vaccine as well, and even after we get the vaccine to get it under control. So yes, it is a funding issue. He is putting a lot of money into funding. That's what he's going to talk. That's what he talked about last night in his press briefing. He's going to talk about that today probably, and to try and get this vaccination done sooner rather than later.
Can you get the monoclonal antibodies before getting COVID?
So can you get the monoclonal antibodies before getting COVID? No. And mainly no, because that's not the way the emergency use authorization was given for monoclonal antibodies. It's once you test positive for it, then you can get it at that point. And part of the reason too is because you might not have any reason to get it, and we don't know if it's going to help you avoid getting infected. We don't know if it affects transmission. We do know that it affects viral load and affects disease process, meaning how sick you get from it, but we don't know if it helps prevent you from getting it. So we want to make sure that the people who need it, the people who are sick, especially the most vulnerable, are the ones that get it at this point. So the answer is no.
After being vaccinated, when can I see my grandkids?
This is a great question. After being vaccinated, when can I see my grandkids? And the question is essentially, after being vaccinated, when can I get back to my normal life? And I'm getting this question a lot. And the other part of the question I get, if I'm vaccinated and my friend is vaccinated, can we get together? Can we meet together because we both have the vaccine? At this point, no. And this is a very good reason. There's a very good reason behind this. Number one, remember the vaccines are around 95% effective. 95% for Pfizer, 94.1% for Moderna. The other ones coming out are looking equally as effective, the Novavax and the Johnson & Johnson, that hopefully are getting their emergency use authorizations in the next few weeks. But 95% is not 100%, so it can break through. And the way it breaks through is by that viral load I keep talking about. Viral load is the amount of virus that gets into your body. If you're around a lot of people with coronavirus, that viral load can go higher. If it's high enough, then it can break through the vaccine. And that's one of the reasons that at some point, if this thing becomes more contagious, even more people get it, that herd immunity number we keep hearing about, around 70%, might have to be 90%. Might have to be 95%, like measles herd immunity is at 93% right now because it's so contagious. And so even though you have the vaccine, even though other people might have the vaccine, until the pandemic gets under control, we still have to do the social measures, the wearing a mask, the washing our hands, the watching our distance, avoiding other people, ventilating our air, our space to make sure that we keep from getting too heavy of a viral load because the vaccine can only go so far. And I tell people all the time, it's just one of the tools in our toolbox. It's not the end all. It's not the one thing that's going to fix this. It's one of the things that's going to fix this.
How long should I wait to get tested after being exposed to COVID?
So if you've been exposed to COVID, how long to get tested? The recommendation is right around 5 days. 3 to 7 days is probably the time frame you want to look at. But and it depends on your exposure as well. What the CDC says is 15 minutes cumulative throughout the day, close within 6 feet of someone who has coronavirus. So if you're in line at the bank and somebody behind you isn't 6 feet away and they have coronavirus and you're there for 3 minutes, and then you're on a bus and you're near somebody who has coronavirus and you're there for 10 minutes. You get the point here. If it's cumulative throughout the day, if you're exposed like that, then you definitely want to get tested. If there's other reasons you think you might have it, get tested as well. But you want, again, probably around that 5-day time period.
How are the new mutations more contagious? Through respiratory droplets? Are we less safe if everyone is wearing a mask?
No. So it's a great question. Are we less safe with the new variants if everyone's wearing a mask? No, the answer is no. One thing they found out is that masks, social distancing, washing your hands, all those things we talk about work well against these variants. And I thank you for the question because that's a big message I want to make sure I get across. So even though we're hearing about variants constantly change. If you think about the Wuhan strain that came out, the SARS-CoV-2 strain, which is essentially the original virus, the original variant of this. It's not a variant because it's the original, but you can't find that around anymore. It has changed so much and mutated so much. It's still SARS-CoV-2, but the letters that come after it have changed, and it's very hard to find the actual Wuhan strain that was out there, the original one. And so what we know is these variants keep cropping up. Masks, social distancing, wash your hands work against these variants. Now, it doesn't mean that it's more likely to be in the air and get into your body. What it means is once it gets into your body's going to have a hard time not letting it get in, not letting it attach to those cells in your body and get the virus into the cell, which is what it needs to live, to replicate and to live. And so if you're around people with this variant or another variant, it's the same amount of viruses in the air. It depends on what virus gets into your body, and then it starts acting. Then these variants start acting to be more infectious, and that's why you can spread them easier as well, because it does come down to viral load. If you get a little bit of virus, then oftentimes your body can kick that out real quickly, just using its general immune system. If you start getting a lot of virus, then it has to be very specific with the antibodies, and that takes longer to do, and it can catch hold. So that is why you want to make sure that you wear the mask, you social distance, you wash your hands, all those things. So thank you very much. This has been wonderful. Again, going over the headlines. Number one, the variants we talked about, strain versus mutation versus variant. And again, to put it in one sentence, the strain SARS-CoV-2 will end up having mutations. If it has enough mutations to make it more advantageous to the virus, then it becomes a variant. And so right now we have a variety of variants. We're going to continue to have variants. The more we look for them, the more we're going to find. We have lagged here in the U.S. on looking for variants, and we're starting to catch up there. And so, again, once we start catching up, you'll start hearing more and more about variants. The question I answer all the time is, should I be panicked about it? Should I be scared about it? No, but you should certainly be aware of it. And again, aware of the fact that the vaccines seem to be working against it, and the measures we use, the masks, the social distancing, washing your hands, avoiding crowds, seem to work well against it as well. So things to think about. Monoclonal antibodies, if you're 65 and above, if you have pre-existing medical conditions that put you at a higher risk of having issues with coronavirus, and you do test positive for COVID-19, ask your doctor about monoclonal antibody therapy. It helps keep people out of the hospitals. And then President-elect Biden, he's going to be coming out with information. He came out with some last night about funding for this fight against the pandemic. And today he's going to be coming out with information about the vaccine rollout, how they're going to accelerate that. And he's going to talk about his 100 million doses in 100 days. And so hopefully we get this robust, we get this really ginned up very quickly. And so we can go ahead and get people vaccinated and get this pandemic under control sooner rather than later. And it is Friday, so I hope you have a wonderful weekend. Again, remember the social measures. I know we're tired of them. Please wear a mask. Please social distance. Please wash your hands. And please avoid crowds, because that's the way you're going to just keep safe. You're going to keep your family, your loved ones, and your community safe as well. But in the meantime, I hope you stay happy, and I hope you stay healthy. Thanks.
Are you a fan of our videos? Be sure to subscribe to Worldwide Campus News and Entertainment. Then ring the bell to see all notifications about the new videos and the latest video.